Despite the fact that most Canadians agree that we have a pretty good healthcare system, we are not happy with wait times that seem to increase as opposed to the other way around. Joining us this evening is a woman who has lots to say about all this and a recent survey that shows these complaints are not unfounded. Welcome, Heather Shantora, the CEO of InnoCare.
Thank you. Thank you for having me back.
Tell us about this survey.
So CIHI, which is the Canadian Institute of Health Information, took the opportunity to survey all Canadians to find out how they were feeling about our healthcare system. There's good news and there's bad news. The bad news, of course, is, as you pointed out, the majority of Canadians are waiting too long for care. So 93% of Canadians identified they do have a doctor. So that's good news. And I think that dispels a myth that many don't. The problem is less than half, only 43%, were able to get a doctor's appointment within 48 hours of their illness.
Well, not only that, but when you need a specialist, the wait. Americans shake their head. They what? You waiting 3 months or 6 months to see a specialist?
That's true. And it varies widely by province. A think tank recently did a study, and British Columbia is actually the worst at 25 and a half weeks for a specialist appointment. And I think this comes down to the inefficiencies in the healthcare system and the opportunity technology can play to speed things up so that we can get Canadians to the right person to take care of them.
Now, we want to know where we are on the list.
Ontario. Ontario is actually the best, believe it or not, at 15.6 weeks. So best is a relative term. That's not a great wait time.
15.6 weeks to see
a specialist.
But you're also finding the survey found that 1 out of 5 Canadians reported waiting 7 days or more to see a family doctor.
That's true, yes. So we performed quite poorly, actually, on the international scale for family doctors, and then even worse for specialists. Where we did do well is Canadians said actually the quality of care that they received was really high, and that the explanation and time that the doctor spent with them was really good relative to all other countries. So our quality is great. It's the wait time's the issue.
So, Heather, are we moving up or down the list?
Unfortunately, down. So in the case of specialists, we actually performed more poorly in this past year than we did in previous years. And that's definitely an issue. But the good news is the quality is good. The only challenge is actually the access to care. Access to care is something we can change. We can change it through technology. We can change it through advocacy. And so of the two, I'd actually rather have a problem that we can solve rather than a much bigger systemic problem. So I think there's hope.
Is it because it's run by the government and the government can be inefficient?
I think it's based on outdated policy and decisions. And in some cases, it's regulatory change that needs to speed up. And because that regulatory change or policies are in existence, which, for example, means a good example is you have to go to your GP before getting a referral to a specialist. Because of some of these policies, they're creating obstacles. The policies need to speed up so that we can more accurately reflect today's healthcare and today's kind of fast-moving environment.
And when we talked before, you explained that part of that problem that you just mentioned is privacy concerns.
That's true, yeah. So as we protect Canadians more, which is a good thing. We want more regulation. We want more concern for privacy and patient data. But it does create them more and more obstacles. And so we really need to balance what it is we want. And if we want patient care and complete patient care, we probably should be more open-minded to our records being shared between healthcare professionals. So we do need to balance what we're asking for as Canadians of our policymakers to make sure that we're not accidentally putting more obstacles in our way.
So what is the solution?
That's a great question. I think there's a couple solutions. I think as healthcare professionals, they need to advocate for technology in their clinics. They need to, and it's their decision. They need to go to companies such as mine, InnoCare, and get things like electronic charting. Electronic charting reduces the amount of time that they have to spend doing paperwork and filling out charts. If they're able to condense that amount of time in their day, they can squeeze in 2 to 3, maybe 4 more patients a day.
Or just keep the schedule that they booked you on.
That's a whole other topic. But yes, exactly. So if they can speed through their caseload faster and more efficient and spend more time with patients and put more patients in, these wait times begin to reduce quickly. So I think that's what the healthcare professionals can do. And the technology is there. They just need to choose it. I think as Canadians, we need to advocate. We need to go to our policymakers, our members of parliament, our members of provincial parliament, and our legislatures and tell them what our concerns are and that our expectation is actually access to timely care. The quality we're getting is great. We're all very thankful for a nationalized healthcare system. We're all very thankful it's paid for, but we need to improve access to that care.
Why is it that the government, the people in charge, are not aware that this is available?
That's a great question. I think it's because they have so many challenges. I think part of the problem is that actually the way that the system's set up. So the government is responsible for hospitals and physicians. What they're not responsible for in the day-to-day sense is other primary healthcare professionals. So example, physiotherapists, naturopaths, chiropractors, etc. If you have an ache or a sprain, you can go directly to your physiotherapist, but governments aren't necessarily advocating for that or not even advocating, spending time talking about that because that's not something that's in their direct remit of concerns. And so they're actually, not bringing that to the attention of Canadians. And if Canadians knew they had a sprained ankle and they can see their physiotherapist within 2 hours versus waiting 4 days to their GP, they probably would make that decision.
So what do Canadians need to know to get the most out of the healthcare system or to access it when it's not working right now?
I think we need to challenge our thinking about always selecting the GP first. I think if we have a sprain or anything like that, we actually need to think about all the primary care professionals that are available to us and make a wise decision. I think historically, just through patterns, we end up keep choosing our GP, but that's not the only option. Canada as well, we access the ER emergency rooms more than any other country. And the reason we do that is one, it's a wait time to see our GP, but two, we're not really aware of what the other options are available to us. So if we fall and, twist a knee, you can go directly to your physiotherapist. You don't need to go into an ER in the hospital or wait 6 days. Correct, you don't. And I think that's really the awareness. So what we can do is help Canadians realize that there's actually many more options available to them. They're just not being talked about as much as they should.
Do you think that Canadians have reached a tipping point when it comes to waiting? I mean, we are a little bit spoiled because it is free. But I feel there's a tipping point coming. People are very angry and a lot of people are talking about it.
Yeah, I actually hope that we're reaching a tipping point. And the reason is anytime you get to that tipping point, it forces innovation. It forces change. And our healthcare system, like every other sector, needs to latch onto technology and use it to improve the sector, innovate the sector. And the idea that we're at a tipping point actually creates a lot of excitement in me because it can push us over the edge to demanding that technology gets infused into our healthcare system, our wait times go down, it's more seamless care, shared patient records, better outcomes for Canadians.
So what can the average Canadian do? Because the average Canadian thinks they just have to pay more taxes to get a better system.
Yeah, I think they need to think differently. As soon as they're injured, think differently. It's not just the GP that can help you. There are many services out there that can help you. So really challenging your own thinking. And second of all, advocate to the policymakers and influencers. So if you're at a function and there's an opportunity to talk to an influencer or there's a member of parliament there, make your voice heard. This is the tipping point. Let's help push it along to make sure that technology innovates the sector just as much as it's innovated every other sector. Healthcare is kind of the last frontier, so let's push that along.
And personally, I don't mind if one healthcare professional that I work with has the information from other ones that I work with. I don't mind about that. I'm not concerned about privacy sharing information.
I don't care if anybody knows anything about my health, actually.
Yeah, so that I think if we can get
so
past
boring.
that would be a good thing. Now, how can people find out more about InnoCare if doctors are out there thinking, I need that for my office?
Right, innocare.ca and innocaresoftware.ca is available, and we actually make our charting available online right away for free for the first little bit because we want them to try it and see the difference it makes in their practice. We know through the trials we've done, we can fit in 1, 2, 3, 4 more patients a day. That is a significant number, and I hope that many more clinicians take the opportunity to use the software and see more patients, spend more time with the patients, and really reduce the time they're spending on forms and paperwork.
Thank you very much for coming in, Heather Shantora from InnoCare.
Thank you so much.
This is what she said. Stay with us.